You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In podcast by Nurse Junior and Anthony.
You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In podcast by Nurse Junior and
Nurse Anthony.
Yes, sir.
Let's go.
We are your COVID-free hosts, man.
Let's go.
COVID-free hosts.
Fucking clean shaven.
Clean shave.
Been a long time.
Long time, man. Bro, I
man.
haven't shaved in, I don't know. This is like the first time in years.
Yeah, bro. 2 years for me. It's crazy since my firstborn.
I was supposed to do a mass fit test and that shit fell through. Well, you just shaved this because, or?
So what it was for me, I just thought I was having like skin issues underneath my beard. So I was like, oh, this isn't good. So I shaved and so I use a straight blade when I shave. So I shaved it straight down and I was like, my skin looks fine. But it was like all gone already. And I was like, I just got to keep doing it. So I was so mad.
No, it looks good on you. Looks good on you, man.
Bro, I appreciate it. Let my girl know that.
Say what?
I said, let my girl know that because she
didn't like it?
Not a fan.
Yeah, most women don't like when you shave completely, honestly. But looks good though.
Thank you, brother.
So today, a lot to talk about.
Yeah,
a lot to talk about. I think on the last episode we talked about the whole hacker situation.
Yeah, we did.
And I know in Michigan, Ascension Hospital, currently, all the nurses have, or the full-time staff nurses, they're part-timers. They walked out because of the unsafe environment that's going on in that facility.
Right.
To the point where the physicians, administration, who else? Nurse managers, they had to essentially take the place of the nurses.
I cannot imagine.
And can you imagine like a nurse manager who used to work bedside 20 years ago now has to go and work bedside?
Bro, I cannot.
Oh my God.
I cannot.
I can't. Yeah, I can only imagine the shit show that's going on there.
Oh my goodness.
The safety issues and everything like that. So apparently, the computer systems are still down. The phones. So communication is very tough right now within that realm at that hospital. So they can't even. I mean, you can't even determine if who needs labs.
Right.
You can't even determine when a patient needs meds.
Right.
ID bands. How can you, like, if you have a patient that's in the ICU that's sedated, they don't have the wristband. How do you identify who and who?
You can't.
You just can't do none of those things.
Dog, and like speaking for myself, when we were there, like when we were in our cyber attack and I had come back to work, it was chaos. Like everything. So imagine this, and I mean, this will resonate more with you because you're in the ICU where when you get labs back, you get these patients with critical values and you have to act on those immediately.
Right.
So imagine you draw labs in the morning or they did it on night shift before they left, whatever.
And they're not back yet.
And then they're not back for like 3-4 hours. And then these critical values start rolling in and you're this is 3-4 hours later.
Later, yeah.
Like
now you got the physician on your ass saying, "Oh, what the? Oh yeah, I forgot we got hacked."
You know what I'm saying? And it's just crazy that everything is just pushed back, right? Like, and in the article I was reading, you had people or one of the nurses saying that like just for a stat head CT, it's taken like 3-4 hours to get results. Bro, imagine you're actively having a stroke. That's the difference between getting
a hemorrhagic stroke. Yeah, the TPA,
yeah,
right?
The TPA, and not getting it. That's crazy.
It's very bad right now, and I don't know. So there was an article that I think I sent to you, and we saw that the hospital came to, I guess, a vote, and they paid the hackers $22 or $21 million for this to end. That's big money.
That's very big money.
So my thing is, hypothetically, let's say that this facility did not get hacked. 21 million. Where the hell did y'all pull that out from? You know what I mean?
No facts.
Yo, that could feed families. That could feed every single staff in the hospital.
Dog.
So you're saying, oh, because we got hacked right now, y'all are willing to pull out this 21 after months of this going on,
bro? I don't. I can't.
Yeah, I can't even fathom the idea. Like,
Bro, I'm gonna get fired.
it'll piss me off.
That's what I'm saying.
So that's what I read, but I don't know if them paying the money already happened or if they're thinking about doing it. But that's what the article stated. But I had a recruiter reach out to me, I believe 2 weeks ago when I went to go visit my mom in Toronto, and they were like, "Yeah, there's a strike happening." Actually, no, my homegirl Dominique, who actually hooked up a job in Alaska. She hit me up and said, "Hey, there's a strike happening in Michigan."
You trying to make money?
Yeah, essentially, she's trying to get me to go back to that fast life. You know what I mean?
You know.
So she sent me her recruiter's number. I contacted the recruiter, and they said all they had left was like cath lab and pre-op and PACU. Now, for me, and this is at Ascension. So if I'm gonna work at that facility, knowing what we know, I think the best bet for me was to go for pre-op, as opposed to anything else, due to the fact that there's so many safety checks in pre-op that you have to take than you would do anywhere else in any other specialty. So in pre-op, you make sure the patient's the patient. You make sure they know what surgery they're having, they understand it, the site that they're doing. Is it a left knee? Is it a right knee? Or you have them sign the site, then you as the nurse signs the site, then the doctor signs the site.
Yeah.
Understand their allergies, have them explain their allergies. So there's so many safety checks. There's so many layers before they even reach to the operating room. You know what I mean?
Yeah.
So the chances of fucking up in the pre-op setting is very slim leading into the OR.
Right.
But after that, I mean, you could easily fuck up.
Bro.
But yeah.
Imagine you just get the wrong patient. Bro.
It's over. It's game over.
Like, this is crazy, man.
Oh, my gosh. But, yeah, so I wanted to do pre-op, but I guess the slots filled up quick, but I wasn't too pressed on it.
Bro, you don't want to get thrown into that lines then, bro.
I know.
Like, if I was given the opportunity to go back to October when we had our cyber attack, and a dude I work with that I'm really good friends with, he was like, bro, don't come back. If you can extend your parental leave, extend that shit. Don't come back. And honestly, looking back, if I could have extended it now, for me personally.
Also, you didn't listen to him.
I did not listen to him. But you have to understand, for me personally, I didn't think it was that bad. Paper charting, it's nothing for me. And being on the unit that I was on with a lot of senior staff, it wasn't horrible. But we also do have a lot of newer nurses. So the shifts where it was like me and all new nurses, they're
very dependent.
This sucks. And it's not even just the dependency, it's everything though. Like, I guess, like the fact that we're supposed to be a well-oiled machine and work like a team and all, it's gone, right? And now I have no problem being the guy that people rely on, but I can't look at everybody's charts and make sure that everybody's charting things appropriately and orders are coming in and signing off appropriately and dosages are all right when I got my own stuff to do. Like,
and were you the charge nurse during those situations?
No. I just happened to be like
the veteran seasoned nurse.
Yes, yeah. Because I'm coming back to work, so I had a couple shifts because I took an extended parental leave where I was training, and I'm training, and people are coming to me asking me questions, and I'm like, I don't know. Nigga.
See, I'm in the same boat as y'all. This is my first cyber attack too.
Yeah, for real. Like, it was crazy, man.
Yeah.
And for me, the whole time I'm thinking to myself, like, man, the like super critical units like ICU, even the ED, man.
Those are the places where you really gotta dot your I's, cross your T's, stay on your P's, stay on your Q's.
Man.
Like, I can only imagine, man. But yeah, so that's what's going on in Ascension right now. Good luck to y'all nurses that are there right now. Be safe, stay safe.
Please
protect your license.
Absolutely.
If it's too much for y'all, abort mission. Honestly, it's not worth it. I've seen too many nurses go down
abort.
Yeah, a fiery hole, and they can't recover from it. Just like that Tennessee nurse that you mentioned that last
yes, bro. Like, it's just
episode.
You get put in And again, obviously, just a lot of mistakes were made. However, if you can willingly keep yourself out of that, keep yourself out of it, bro.
Yeah.
You know what I mean? Like, it's just your license at risk. And now that if we could be criminally liable for these mistakes, like, don't put yourself in a harder position.
For sure. But yeah, anything new? Any stories or?
Yeah, bro. So this is more like an interesting thing. Like, I've always thought about what this is like, and it kind of made me think this past week. So I had lunch with one of my old coworkers. She now works on the psych unit.
Okay.
All right. So she was telling me a story about this young man that I guess he's always been like a troubled young man in the sense that like he's always done things that, you know, like will make people gasp. He's like hitting his brother a little too hard, being a little too aggressive. Anyways, he's kind of been like in and out of psych units and things like that. I guess he's back in the psych unit, and the reason being is because he was stalking this young lady that he goes to school with that didn't like him. So he was essentially like threatening to kill this young lady.
So let me pause you right there. It's funny because I was talking to my coworker today at the surgical center. Her name's Sabrina. We were talking about stalkers, actually. So I brought up to her, there's this one show on Netflix called Baby Reindeer. Have you heard of it?
I've heard of it. I started watching the first episode, actually.
Bro, that's the
It's
first thing.
crazy.
That's what I'm picturing right now,
Bro.
based on what you're telling me. This guy is stalking a young lady. But in the show it's
It's a woman stalking a bartender.
Yes.
Yeah.
And crazy. Like,
Bro.
she's nuts. So I can only imagine.
Dog, and now this is a young man, unfortunately, that's been unstable, right? Like I said, he's been in and out of psych units. And what really brought his parents to essentially getting informed was they found some sort of dead animal and were able to identify that their son killed this animal. Right? So you couple all that together, and his parents were like, bro, we got to
do something.
So my question was, like, what do you do with this young man, right? Because so he's in the PICU, so he's in like the psychiatric ICU. So when he gets out of that, and you guys deem him stable enough to discharge, like, because if this is my daughter that he's been stalking, and he threatened to kill her, and now he's killing animals,
Yeah, I'd be concerned.
I'd be super concerned. Like, at what point do we like put him in an institution and make sure people don't end up dead here? You know?
Yeah, it's a tough line to really gauge right now because he technically didn't commit a crime.
Right. And he's still a minor as well, apparently.
Okay, he's still a minor.
Yeah.
Stalking a classmate at school.
Like,
The only solution is if I'm the father of the daughter, I'm moving. I'm packing up and I'm getting the hell out.
right? Like, you don't want to keep your family in
You
that.
don't. And then
Like-
not only that, but as other parents are hearing about this story within the classrooms and
Absolutely.
the school, I'd be concerned as well too, because that could be
Absolutely.
my daughter as well too.
Without question.
So, that's
So this is the thing. Apparently, this young man's also schizophrenic, which I'm sure is not super surprising. So then I was like, man. Now, I don't want to sound insensitive, but I kind of was wondering, like, what is it like to be schizophrenic and, like, hear these voices? Because as she's telling me the story, that same day I had a patient that was also schizophrenic, which is kind of how this conversation started. And so at one point, the social worker was in the room with my patient, right?
Right.
And I was just in there, you know, taking care of him and his neighbor. And so he's talking to the social worker, and then out of nowhere, it's like he's looking at her, and then he looks to the side, and he's like a Sudanese dude, and he starts speaking his native Sudanese language. And the social worker's like, who are you talking to? Because there's no one beside me. So it looks like he's looking at someone beside her. And he's like, oh, I'm looking at my parents. And talking to my parents and whatever. And so after he's saying all this, obviously we identify he has a history of schizophrenia because it wasn't on his chart. And
it wasn't on his chart.
It wasn't on his chart. We had no idea until he said this, and then we started like going down the rabbit hole. So in this is crazy that we're talking about this. His first psych admission was during our cyber attack. So that's how it got lost in translation, because we didn't have. There was obviously a lot of holes in the timeline for people. So anyways, yeah. So he's schizophrenic, and I was like, man, can you identify like the voices you hear versus like my own, for example?
Right.
And he's like, yeah, absolutely. So then I was thinking, like, at what point does it become, I know not to listen to that fake voice and I should listen to the real voice? And like, where does that get lost? You know? Because that's crazy.
Because the thing is, with these voices, they hear it every day, right?
That's right.
And honestly, and this may sound dumb, but honestly, this is a serious question, but the voices that he's hearing, are they his own voice, or are they someone else's voice, or you know what I mean?
So based on our conversation, he hears a lot of different voices.
Right. So imagine hearing your mom's voice, and you haven't seen your mom in how many years, or she's passed away, and you just hear her voice. It's nature to just obey your mother or your father. You know what I mean?
Absolutely.
So I mean, it could be a situation like that, but yeah, like just for him to turn to the side and kind of space
out
off
of nowhere.
It's just like with the kid that you just mentioned. Imagine him in class and he just has those sporadic episodes in class, and everyone's like, "Yo,
what is happening
on?"
Yeah,
that could be intimidating for some of these ladies and some of these men that are in the classroom, even the teacher. So, and you know that makes me think now: do schools these days have nurses? On the Canadian side, like psych nurses are just
not when I was in school.
Yeah, that was me either. I know some states do, but yeah, I don't think in Canada. I don't think I've ever come across a school that has a school nurse.
I don't think so.
That's something that the system needs to look into.
Yeah, man, because that is a super scary situation. I can't imagine being part of that, bro. Like, I can't.
Wow,
man, and even for his parents, man, I felt for his parents because I was like, man.
Yeah, and I don't know what they would honestly do. It's just a matter of him.
With your son? Just
make sure he's compliant with his medications, and just talk to him and be, a part of his life on his everyday basis.
Absolutely.
Really. But I mean, parents can only do so much. If you're a single parent, you're working, you have other kids, life can get busy. But man, yeah, I don't know. It's a tough predicament.
Yeah, bro.
Hopefully those students stay safe and he gets the help that he needs.
That's what I'm saying.
But yeah, for me, what is going on in my life in the nursing home? Actually, this brings me back to a story that happened way back in the ICU. It has nothing to do with anything psych related, but I had a patient. This was in Michigan. We'll call him Mr. Johnson. Mr. Johnson, he was he wasn't too sick. I think he came in with like pneumonia-like symptoms or something like that.
Yeah.
And he was on the verge to being intubated, which is essentially, they put a tube down your throat and they can hook you up to a ventilator and it helps assist you breathe. But thankfully, he kind of beat that, and we just had him on oxygen and just did some basic treatments. Anyways, I think one night, so in the ICU, they usually have protocol orders that they put in, like chest x-rays, labs, so that way the doctors don't have to keep putting it in every day.
Yeah. Almost like medical, or at least for us, we call them like medical directives.
Yes.
Where you can just kind of go.
Right.
Yeah.
So, he's due for his chest x-ray, but this in the ICU, they usually do like portable chest x-rays.
Yep.
So, you can typically hear when the machine's coming in, like rolling down the hallway. Yeah. So I'm just sitting charting, and the I guess she's radiology, or is that?
Yeah, I guess maybe.
Yeah, radiology. Yeah. So she's strolling in. This girl, beautiful woman, and she's a bit older, but beautiful woman. And she walks into the room. My patient's a heavy set guy, so they usually put like a board behind the patient, so that way it can, I guess, capture the lungs more fluently, and it won't, I guess, get images behind the lens.
Okay,
sure.
Just like a clear image.
Yeah,
of
clear
what
image.
You needed to
right.
Do. Yeah.
So I'm charting. She comes. She taps me behind my back. I look up. She goes, "Junior, I need your help." I'm like, "For what?" "To lift up your patient." I'm like, "All right, cool. Why not? Let me get up, help her, lift him up. Boom. Step outside. She takes the image. I'm looking at the image and I'm saying, "Oh, is everything looking clear?" She goes, "Yeah, looking better than what it was a few days ago." I'm like, "All right, cool." Now, Mr. Johnson, this guy was probably born in the 70s, not even 70s, maybe the 60s, 70s, yeah. But he's a Mac. Like, this guy's a flirt. So, see, I'm bleeding it. You'll see.
Yeah.
So, mind you, like I said, beautiful lady, body's nice, hair done, nail did, everything.
Did. Let's go.
She's wearing her figs.
Hey.
Like, she's looking good.
Yeah.
So, Mr. Johnson, and I'm trying to let me get the phrase or the word out correctly, or the sentence that he said. So she's about to roll out, and he goes, "You trying to give me diabetes with all that cake behind you, baby?"
Oh my God,
Bro, I'm stepping out. I'm about to step out, and I hear that, and I turn back around.
Crazy, bro.
And I'm like, "Yo,
that is crazy, yo, Mr. Johnson, you wild,
Mr. Johnson's
you wild, man."
So I'm like I said, I'm about
That
to
is
walk
the
out.
funniest thing I've ever heard.
All I hear is, "You trying to give me cake with all that diabetes? No, you trying to give me diabetes with all that cake you're carrying behind you, bro." I'm like,
crazy,
yo,
bro.
Whoa.
That is crazy, G.
I just burst out laughing. I'm like, yo, this is insane. And then I think the girl, she goes, Mr. Johnson, you are too old to be talking to a young lady like that.
That is crazy.
And he's like, my apologies, baby. My apologies.
This guy said baby.
Yeah, bro. He's a Mac. This guy's like in his 50s, 60s talk. Bro, I couldn't believe it. So now she steps out. So he coughs and he goes, he's laughing about it and he's coughing and he goes, "Can you tell my nurse to get me some water, please?" She goes, "Yeah, I got you." She goes, "I got you." So I already heard it. So I walked out, got it for him, came back, and I'm like, honestly, cake ain't a bad thing. You know what I mean? That's what I said to her. I said, "Listen, cake ain't a bad thing." You know what I mean?
That's hilarious.
She looks at me and she goes, "Junior, nah, it's too early for this shit."
So funny.
"Junior, it's too early for the shit." I'm like, hey, my bad. If he lying, he dying.
Bro, think if he's swoop.
So I go in there, I give him the cup. I'm like, "Yo, Mr. Johnson, I didn't know you had it like that."
That's so
He goes,
funny.
let me get the voice down properly. "Listen here, nephew. Listen here, nephew. Back in the day, they used to call me Big Mac."
Oh shit!
I'm like, "Big Mac?" He go, "Big Mac?"
Yeah.
"Yeah, Big Mac." I'm like, "Why they call you Big Mac?"
That's hilarious.
"Because back in the day, the ladies loved me. I had that bacon, lettuce, and cheese." I'm like, bacon, lettuce, and cheese. You heard me, nephew. I'm like, yo, that's crazy. So I had to dap him up one time. I hit him with the dap. I said, "Hey, Mr. Johnson, you a Mac daddy. I hear you."
That's hilarious.
So I step back out. I'm documenting. And like 5 minutes goes by and I'm thinking to myself, I'm like,
bacon, lettuce, and cheese.
Bacon, lettuce, and cheese.
Yeah.
I'm like, yo, wait. A Big Mac don't got no goddamn bacon in it. What the fuck are you talking about? I was gonna go back in there and ask him about it. I said, "Nah, let me just leave that shit alone." But
is funny.
Mr. Johnson was funny as hell.
Yo, Mr. Johnson is a Mac.
He's
bro.
a Mac, man. I used to have a lot of patients like that were just smooth talkers, like real Detroit players. So.
Yeah. You see, you guys get them, bro. In Windsor, we just get a lot of fucking old and weird perverted men, bro. Like,
it's true.
yo, so I can listen to a story like that and just die of laughter because that shit is funny to me. In Windsor, bro, they just be doing weird things, man. And I gotta step in and I'm like, "Bro, why are you doing this?"
Yeah, man.
Bro, you're like 90 years old, groping on a fucking
Tech.
22-year-old fucking tech trying to get some blood work done. Like, you're just weird, you know?
It's crazy, man.
Why can't you be more like Mr. Johnson, bro?
Yeah, be a smooth talker like
know what
Mr.
I'm
Johnson.
saying?
Don't be a
This guy
pervert.
said,
Don't be like Herbert the pervert from Family Guy.
I said Herbert the pervert. Yeah. This guy said,
man.
don't give me diabetes, or you about to give me
Diabetes with all that cake you're carrying behind you.
Damn.
She was thick. I will say that.
That's fucking
So now that leads me into so I was thinking, you mentioned students, right? Do you have you ever been offered a gift by a family member?
all the time.
So you know how they have this unwritten rule in nursing school where if a family member gives you a gift, you must decline?
Yeah.
Yeah, I've never declined shit
You
in
know
my
what's
life.
crazy? I was just thinking about that this week. I swear on my mom's life. Bro, so I've been getting a lot of gifts from family recently. Like a lot of gifts. Now, what I do usually, I'll just especially when it's food, I just share it with everybody.
Yeah, for sure.
But yo, listen, I'm not saying no. All right?
Me neither.
Give me the motherfucking gift.
Give me the gift.
Bro.
Man, it was so I remember, I think it was my second year clinical placement. Honestly, in second year, that was probably my roughest clinical placement based on my instructor. She was on my ass.
Yeah.
So sidetrack, this instructor, I'm not gonna say her name just because, I don't want to put her on the spot, but when I tell the story, and maybe some people that are in my clinical group, they'll know what I'm talking about. So, man, I might have told you this.
I'm sure you did.
I might have. So, I think me in nursing school, I had the high top, I had the hoop earrings. Like, I was trying to be like, yo, I shouldn't be like this guy.
You were a young Mr. Johnson, bro.
Right, a Mac.
Yeah.
Man, I was just, like, I had the Jordans on, and usually with my Jordans, like, I usually had the tongue out, and I used to, like, tuck my scrubs in, so, like, the Jordan symbol was showing.
See that I'm rocking them Jordans.
Yeah, you could see.
Yeah.
So, coming to clinical, I'm ready. I'm ready for the day. And my instructor, she comes up to me and she goes, and my clinical group's all around me. We're all ready, start the day, and she looks at me up and down. She goes, Junior, are you here to be a basketball player or a nurse? Bro, I'm like, yo, what the hell? Yo, on the first day, you coming at me like this? And the girls that are standing beside me, they're giggling. I'm like, yo, this isn't a laughing matter. Like, she's on my ass.
Absolutely.
Like, so that was one situation with her. But anyways, later on, as the clinical weeks progressed on, I had a patient. So we usually had clinical start like around 6 a.m. and we finished at about, 3, 4, depending. Long hours, man, long hours. So I had this one lady, super cool. She was in there for a couple of weeks, helped her get water, did many things for her, answered the call bell. And the next week after, I guess she was still there. And her daughter was there. So I went in, said good morning, introduced myself to the daughter. And the patient was like, oh, darling, this is the young man that I was telling you about. He helped me so much last week. Ray Tay Tay, blah, blah, blah. Like, this is him. Give him the gift. Give him the gift. So I'm like, oh, wait a second, gift. Okay, that's what I'm talking about. So the daughter opens up her wallet and she gives me a gift card for like some restaurant.
Oh,
I'm like, ooh,
I'm hungry.
I'm finna eat.
Yeah,
and as a student,
absolutely,
man, my pocket had a hole in it. Like, I'm ready.
Absolutely.
I'm like, I ain't eating no noodles today.
No.
So crazy enough, I took the card and my instructor just manages to walk in. Maybe she overheard or something. And she goes, Junior, I hope you didn't take that card. I'm like, I did. I ain't gonna lie about it. I did. I took it. She offered it to me. She goes, no, give it back. I'm like, excuse me? She goes, yeah, give it back. You know the rules. I'm like, damn. So I had it. And they were insisting. They were like, no. He's been such an amazing nurse to my mom. Nope, ma'am, he cannot accept this gift.
So your teacher went in with you and was like, no, we're giving this back?
Yes. So there's this in nursing school. I don't know why we all did this as students, but after every midterm evaluation, we would go to this restaurant right by the hospital. I think it's called Penalty Box.
Oh, yeah.
And there's this one meal that everybody gets. I guess it's like
Chicken Delight.
Chicken Delight. Man, so me personally, I did not want to go to the goddamn penalty box after midterm evaluation. This woman just failed me.
Yeah.
And all of y'all are happy and y'all want to go to eat a Chicken Delight. Like, what the hell are we talking about? This lady's out to get for
You
me.
want to be anything but delightful right now.
Yeah, you want me to have dinner with this woman? Like, and be all giddy?
So the instructor was going to come too.
Yes,
Oh, that's
yes,
crazy.
yes.
Ain't no way.
They all, and she agreed to come. So and me, during those times we go as a group, right, to clinical. So me and my one homegirl in my clinical group, we would cab together. So obviously she passed her midterm evaluation. I failed mine. She failed me. So, I can't leave without her because hell, my cab's gonna be like $25.
Right.
So I said, shit, I might as well just go with them to goddamn penalty box and eat this goddamn chicken sandwich. So I'm sitting there and I'm just pissed. Like, I'm just like, And I'm just looking at this lady across my, with my eyes. And I'm just like, yo, you really failed me?
I was about to say, having dinner with her right after she failed you was crazy.
I was pissed. I was pissed off. And the crazy thing about it, too, is these clinical instructors are making like $90-something an hour off of us.
Yes.
She couldn't have the decency to pay the goddamn bill.
Bro, she don't give a F. She probably took the gift card was probably a penalty box gift card. She probably went back.
She probably took it.
Oh man.
Oh man. But so yeah, that's just a story that I experienced.
That's crazy, man.
Yeah. But gifts, man, like it's crazy because after I graduated as a nurse, the gifts kept coming in. Like, I love the patients or the family members that bring in, like, pastries.
Oh, my
or
God.
order pizza.
Oh, my
They're the best.
You look at me, bro. Look at me. I eat, bro.
Oh, man. I eat too, man.
I'm not saying no. All right? Don't expect me to be ethical. All right?
There's this one pizza in Detroit. It's called Jet's Pizza. You ever had that?
I've had Jet's once.
Oh, my God.
Bro, honestly, man, Detroit pizza ain't it for me.
Really?
I just don't. I honestly think Windsor pizza is amazing. If you go to the right places. If you go to the right places.
You said you used to work at a pizza shop.
I did, yeah.
Okay. Yeah,
right by my parents' spot. So I had my son's first birthday this weekend and Junior was there. And so it was that spot. But that wasn't the pizza that I would get usually.
Okay.
Yeah.
That was a party box.
Yeah.
Okay. Yeah, man. So that's
crazy.
That's a story.
I've never had dinner with somebody that failed me though. That is
it was very frustrating just looking at her.
So
granted, I did pass though.
You know what's crazy to me though too is that I feel like a lot of the time for these clinical instructors at the end of every semester or whatever, the group wants to like get the instructor a gift.
Bro,
did you guys get her a gift?
I'm sure we did, but I don't think I pitched
Bro,
in
that's
shit.
crazy.
I don't think I pitched in anything.
Dog, that is crazy.
Looking back at it, I think the only times here's another story. First year, my first year, second semester, they usually have us in a nursing home. So the placement that I was at Chateau Park Nursing Home. That facility's wild, but at the same time, I get a lot of kudos and a lot of respect to the nurses that work at nursing homes because that's not easy, man.
Not easy.
Looking over like how many, like 60 to 100 residents. I don't know how many residents were at Chateau Park in Windsor, but man, they weren't easy to take care of.
The nursing staff, the PSWs, it's just too much.
The medication administrations, the blood sugar checks, the feedings. Oh my! That's when I really said, all right, this nursing game ain't no joke. Like I don't want to be in the nursing home. I want to be in the hospital.
See, and for me, so it's never easy to navigate around family members. I find for patients or residents, whatever the facility that you're in, whether it's a hospital or long-term care, I always felt it quite interesting for long-term care family members because so I briefly worked at a long-term care and I did not enjoy it. And my thing was family members are very insistent on the care for their parents or their family member, whoever's there. However, this isn't a hospital. Like you can come and help care for your family member.
Yes. You
Come
can be
and help.
involved. You can be involved.
So, especially the ones that like are so adamant on yelling at people and not being very friendly to the staff. You can be here.
100%.
Bro, come, please.
Clock in.
Yo, clock the fuck in.
We could get you a badge.
That's what, I'll get you a chair.
Credentials.
You think what we're doing? Come, please.
Come into the trenches.
That's what I'm saying. Like, so for me, that was tough dealing with family at a long-term care, just because some, not all, but some are so insistent on how they want care for their family, but then aren't around.
Yeah. So, like, during those times, I do remember some family members coming in, whether it be in the afternoon, morning. Granted, we're all busy. Yeah. We all have our own, kids and other family members. So, it's time management at the end of the day.
Of course.
But yeah, no, I completely understand where you're coming from with that. But at the nursing home, man, kudos to them, because it was just a lot of work. And I think that's the one placement where, we would go in early in the morning, 6 a.m., come back home, I'd shower, and I would just be tired.
Yeah, absolutely.
Like, I can't do anything because I really worked my ass off.
I agree.
So, yeah. So, anyways, yeah, my clinical instructor there, I think her name was Selena Uciletti. Amazing professor. She's one of those individuals that embodies and encompasses what a real nurse is to me. Man.
Yeah.
So I'm sure we definitely got her a gift. We definitely got her a gift. At the end of every clinical, we usually take like group photos. So I think so I'm sure on Facebook I have a few photos with some of my instructors throughout the years. But yeah, she's one of those instructors that's very memorable to me.
Yeah.
There was an incident where we were feeding somebody. Okay, yeah. So there are times where we go to the lunchroom. It's lunchtime, and we go in and we help feed the patients. Mm-hmm. So there's this one lady I'm helping to feed, I don't know, I think I'm feeding her applesauce or whatnot. And then she's looking at me, and I'm looking at her, I'm like, is there something wrong, miss? She's looking at me, she goes, come here. So I'm like, and me as an idiot, I'm going in. I'm like, yeah, what is it that you need to tell me? Closer. So I go closer, bro, she takes my face, and then she kisses me on the cheek. Oh no! And then she goes, "You're just so damn cute." I'm like, so "Yo, funny. Bro, I thought I was gonna fail." I'm like,
He's worried about his mark.
I'm like, "Professor, she kissed me. Am I gonna fail?" She goes, "No, Judy, you're not gonna fail."
That is hilarious.
Like, okay, thank God. I'm like, man, you need to keep your lips to yourself.
That's hilarious.
I'm trying to make it out this game.
Junior's just trying to pass, bro.
I'm just trying to pass. I ain't trying to be in no lawsuit.
That's the female Mrs. Johnson. That's Mrs. Johnson. That's
Mrs.
There,
Johnson.
Bro. She just knew what she wanted and went for it, bro.
Looking for her Mac Daddy.
So funny.
Looking for her Big Mac.
Oh man, she looking for her lettuce, bacon, and cheese. God. Damn.
Oh my gosh! But yeah, that was the nursing home was good, man. I would find the craziest things to do there. Like there'd be times where all the ladies and the men, they're sitting in the living room lounge and they're watching The Price is Right. I'll sneak myself in there and kind of camouflage myself with them and just sit there and watch. Who was it? Drew Carey at the time.
Oh my God.
Man, they would just be watching just Wayne Brady. What's that show? Deal or No Deal. Bro, they have a routine at the nursing home.
Oh, without question.
So,
bro, some of those old folks, man, were the funniest. Like, I enjoyed really interacting with people at nursing homes. And I remember one time, it was like I can't remember if it was breakfast or lunch. It was breakfast or lunch. And there was always these three ladies that sat together, right? And they're all in like their 90s. And they are sitting there, they all get there, and they go, "How are you doing today?" Like one at a time. "Good. How are you doing today?" "Good. How are you doing today?" So like
they're asking each other.
And then they go, one of them goes, "What were we just talking about?" And the other two go, "I don't know. How are you doing today?" I was dying, bro. I was like, man, these women have no clue what the hell's going on. They don't know
but that's the life.
But they were all, the way they were laughing was so like funny and innocent, and just genuine that I was just laughing with them, bro.
See, that's the life.
It's hilarious.
Man.
It really is.
Life. Oh man, looking back at it, yeah. So I mean, being a nursing student, so this is something I want to ask you. Do you feel like nursing students should be getting paid for their clinical placements? And do you feel like that's something that might change down the road moving forward? And the reason why I ask you this is because, my brother came down and, he plays basketball in California, and a lot of these student athletes, they're getting a bag, like they're making money.
Bro,
Off of these like NIL deals.
so I don't know if you heard recently, this is totally off like the nursing topic, but the NCAA actually, like, they settled this week that present and past players, it was like a $20 million, which is obviously not enough, but it's like it was settled that they have to, each individual school has to pay players past and present that they've made money on.
Whoa.
Each individual school, yes.
Bro, there's like hundreds.
Hundreds. Yeah. Damn. But obviously, unfortunately, there's a cap. But yeah, that came out this week.
I'm about to read that.
Yeah. It's crazy.
But yeah, it's just amazing how much money they get. But looking at it from a healthcare, nursing student perspective, man, we're putting in hours. We're putting like thousands of hours.
Dog, I had a student this year that's in preceptorship. So he's got to do, over the course of the next, because it's his last preceptorship. So he's got to do 400 hours before August. Okay.
Yo, that ain't easy.
Yeah. So he's got to do 400 hours before August. He's working full time with one of the nurses that's a full time on our unit. However, this nurse has vacation days that she's allotted. So the days she's gone on vacation, he's getting like less hours, which is why I had him for the day, because he's trying to like find other nurses that'll take him or whatever, right?
Yeah.
So, bro, this guy is renting a place, and he's from out of town, so he has a car that he's paying for. He has a full-time job, but because he's working full-time with this other nurse, his hours are scarce.
Yeah.
So he's like, bro, I don't know. And he looked tired, bro. He's like, I don't know how I'm going to navigate this. And I was in the same boat at the time. Like, I was in the exact same boat. And looking back, I was like, man, it's crazy. You're essentially working 2 full-time jobs because you got to still pay for your life, all this stuff. So to answer your question, do I think that we should get paid for the hours? Yes, I understand if they want to do like, because under minimum wage, there is like a student wage that.
Yeah, give us something that's like maybe $5, $10 an hour.
Like
we'll be happy with that.
15 an hour, because now I don't have to stress about working my other job or paying tuition, or because you have to pay. So for us, you have to pay for your preceptorship because it's technically still a semester. Yeah, so that's another thing you have to think about. So you're essentially still paying to work in a hospital. Right. And a lot of these nurses take advantage of these students and will have them doing everything.
That's what I'm saying.
Look, so not only do you have them doing everything, as the nurse, you actually get paid like a couple dollars extra to have these students for
bingo.
So I'm getting paid more to do less. This dude is doing a crazy amount of work, and he's paying to do it. You know what I'm saying?
And then at the end, they expect us to get them a gift.
Isn't that crazy, bro?
Like, what? So that's why I said, yo, I'm not putting in shit for this professor, for this instructor.
Way, bro. And, like, obviously as a student, you're so timid and you don't know. Bro, when I had this kid, he was so very like, okay, like, what do you want me to do next, bro? Relax.
Yeah, get a cup of water and chill.
You could go in the staff room for 12 hours for all I care. You'll be fine today. Like, because I am so against these nurses that just sit there for 12 hours and have these young kids do everything.
Yeah. It's not good.
It's crazy to me.
It's not good.
Like, it's insane to me.
So you think about $15 is fair?
I would think the student wage is fair, right? Okay. Because it's still under minimum wage, but we're like, and at the very least, give some sort of relief on tuition.
Yeah.
You know what I'm saying? Okay, maybe you're whatever semesters. I mean, we always have clinical, so it's hard to say, but maybe just give some sort of relief on tuition, because this is crazy. Like, it's crazy that these kids are expected to work these hours.
It's true.
Like you said, for clinical, these students are there at 6 a.m., and then they're there till like 3, 4 p.m. Like,
we got to worry about transportation. Mm-hmm. We got to, make sure we're there on time. What else?
You got to pay for your scrubs.
Scrubs.
Like,
There's just so much.
And
that
then
I'm not
after
even
that,
thinking
you
about
have an
right now.
assignment after. So it's not even like you can go work
Yes.
after. You have your clinical assignments.
You have
to do.
homework
You still have
after
school.
you do the 12-hour shift.
Right. You still have school to go to. Like, it's crazy, bro.
So for y'all that don't know, in nursing school with their clinical placements, not only are you working on the unit doing nursing activities as if you are a nurse already when you're really not a nurse yet,
Yep.
you have homework. You have to do journals. So the journals are based on events or something significant
Like
that
your
happened.
specific patient that you
Yeah.
had or patients.
Yeah, like for example, let's say my patient had diabetes. Let me find the article. What is it
Yes,
called? Evidence-based
Yeah,
practice
I
article on
forgot
diabetes.
about those articles we had to
and
get.
relate it to how your patient did so and so, how it relates to their diagnoses.
Yes.
Make it a 3-page. It's like, yo, what is going?
Yes.
I'm gonna be honest with you. Me back then in 2013, 14, 15. I was copying other people's journals from years
100%.
above.
Without
Because, I
question.
mean, you had to find shortcuts. There's no way I'm finishing a 12-hour shift, not even a shift, a 12-hour clinical placement shift, and then doing my assignment and then submitting it the next 2 days after when I have anatomy and physiology in the morning. There's no way.
And then it didn't matter if you had exams, whatever the case may be, bro. You still had to handle. And for us, it was the next day.
Yeah.
They needed that the next day, and I was stressed.
And the instructors, they don't put that into account. It's like, yo, we have lives outside of this as well,
they
too.
don't care, man.
You know what I mean?
Yeah, absolutely.
And not only that, so I'm sure y'all had the CPEs. Mm-hmm. So CPEs are like competencies. Yep. So like there's like hundreds of them. Yes. So for example, name a time when you had to, handle an ethical dilemma situation in the workplace. It's like, yo,
bro.
What?
And so for us, every week there was. So for us, it wasn't like they say, like you said, like give us an ethical example. They go, this week, tell us about one of the CPEs that you dealt with and go into detail about it. And every week had to be something different. It couldn't, at no point in the whole semester, could you have said the same CPE even though it was a different scenario.
Oh, so they wanted all new situations.
And I was like, bro,
come on, y'all are killing us right now.
So you know what I would do? There are a couple where you could they were obvious, but I would wait to use them. So I know one of the CPEs is like something about getting to work on time. So I was like, yo, when I can't, so when I can't think of anything, boom, this is what it's gonna be.
Yeah,
because I was like, this is nuts,
bro. It's so much.
Like
it's so much.
It is so much.
And I know nursing students are going through it right now. And if you're a nursing student right now, you know what we're talking about. And if you're not, it's hell. Journals, CPEs. I might be forgetting something else. Sometimes they'll throw in other assignments like a presentation on.
Goodness.
It's just assignment
you have
after
OSCEs
assignment
to worry about. Oh my
OSCEs.
God. So much stress. I forgot about all the stress.
OSCEs. That's another story I can tell you about. So in my 4th year, was it 4th year? I think it was my 4th year.
Yeah.
I was looking for a part-time job during school just to help pay out fees.
Yeah.
And there's this one instructor. I can't remember her name. It's going to bother me. But nevertheless, she hooked me up with a job. My homeboy DK told me to hit her up, which I did. And she got me a job to work at St. Clair College, which is in Windsor. And she put me with the nursing program. So I was one of those standardized patients. I was one of those standardized patients.
Yeah.
So, you have first-year nursing students that are coming into the room. You're the patient. You're sitting there in a gown. And, that you pretty much go through this whole routine that you studied the night before. Mm-hmm. And they're asking you questions, I
was paid, eh? Oh,
I was getting paid, yeah.
Was cool.
If I need to see if I can hit her back up because that's a good side gig if you're a student, honestly.
Yeah, absolutely.
Anybody can do it. You don't have to be a nursing student.
That's right.
Because when I did it, man, there were some elderly people that were in that role, middle-aged. But, so it was just me. And little did they know I'm a nurse. Mm. So they don't know that I'm a nurse. They don't know anything about me. So they're assessing me, doing the lung exam, cardiac, assessing my body. And I remember there's this one female, she was just doing the most to the point where it was like, yeah, so on the back of his neck, there's a rash. I'm just bullshitting. To the point where I'm like, yo, whoa, what are you?
Yo, stop hurting my feelings.
Wait a second. I have a rash back there? What are we talking about? Like, she was telling me shit that I didn't even know about myself. I'm like, damn, that's crazy.
She was hurting your feelings. That is so funny.
I'm like, yo, tell me more about it. Like, what's going on back there?
Oh, that is so funny.
Man, it's so...
There's some discoloration on the back of his neck indicative of cancer. Wait,
I'm like, yo, whoa, chill.
Oh, that's so funny.
Almost broke character at that point.
That is hilarious.
I had to keep my mind on the money at the time, so I just went with it. I'm like, okay.
That's so funny. That's hilarious.
But man, it just amazes me how, like, as a first year nurse, how nervous we were during those OSCE scenarios.
Oh man.
So it's like for y'all that don't know, I don't know what OSCE stands for. It's
I don't
like
either.
It's like a standardized test. So like you're pretty much going through scenarios.
Right.
They're not fake scenarios. They're like real life scenarios that you may see when you actually graduate and transition into the work field in nursing. So it just assesses your patient clinical skills and knowledge-based practice.
And based on what you learned that semester. So it doesn't get, as the years progress, at least for us, it got more and more difficult.
Complex, right.
More complex issues. But like, as an example, I can remember one of my first ones was like, so for us, we'd get there's like multiple envelopes. You have to open the envelope to see what your scenario is. You read it. I don't remember if you read it out loud or in your head, whatever. I think you had to read it out loud because it's you and the instructor had to know which scenario you got.
Yep.
And based on your scenario and what you're reading, what to assess and why, it was like a more targeted assessment. And
so let me go into a deeper bag on that whole OSCE scenario, right? So imagine, you wake up in the morning, get dressed, you got to wear your scrubs, have your stethoscope, have your watch, everything. You got to be full-fledged nurse that day. Now you go to the building, you have your clinical, you have your professor there, you have your standardized patient, whoever that may be. There's a glass mirror there's a glass mirror and there's a camera behind that mirror that's pretty much recording you just in case anything goes wrong. So there may be a situation where they mark you wrong or mark you on something that you didn't do, but you go, hey, wait a second, I did talk about that though. They can go back to the tape and review. Like review on the flip. Yeah, you better review that shit. You know what I mean? Give me my mark.
Challenge, throw the flag.
Challenge. Yeah, I'm challenging that. I did check for the pulse. Yeah, don't test me on that. You know what I mean? So they have the glass mirror where you can't see who's behind it, but whoever's there can see you. So the camera's recording you. Instructor. Now you mentioned the 3 envelopes. Yep. It could be respiratory, it could be cardiac, or it could be
like neuro. Yeah.
For the most part, you did not want to get neuro or cardiac, if I'm not mistaken.
Yeah, my first one I got cardiac, and I was like, oh my God.
Yeah. So it's like labeled A, B, and C. And sometimes, back in the day, if you had a friend who went before you, they'll be like, yeah, choose C. C's the one.
Yes.
But then the instructor started to pick up, they switch it up.
Yeah. I
remember that. But I remember the very first OSCEs, it was like blood pressure. So they give you a time limit of 30 minutes. Yeah. 25 of those minutes you can use to review the assessment that you got. So let's say you got respiratory. You have a notepad that you can write down certain things that you feel like you may forget. Yeah. So that way when you're doing the assessment, you can kind of review it and then kind of do it in the moment. And then from there you have, I believe, the remaining 25 minutes after the 5 to actually start your assessment. And I remember when we, as you first start off as a nurse, you got to do the blood pressure assessment, Man, it's mind-boggling how it took us 25 minutes to actually get an actual blood pressure cuff reading.
Yes.
And in those days, I think we talked about it in
two-step.
Was it? It was a two-step. Yes, it was a two-step.
Yeah.
And then the professors had those double stethoscopes.
Yes, I forgot about those.
Yeah, where you have the stethoscope on, and then they have it on.
Yeah.
And then you're assessing, and then you're listening to the the cuff.
Yeah.
Or not the cuff, the pulse to see when it'll diminish. And you kind of give them the number, and they're like, okay. You said it's 130 over, and now you're like, all right, so I might be off. I'm gonna do it one more time to be safe. You do it one more time. She's listening to.
Oh, that's so funny.
And your professor's right beside you. It's like, yo, chill, get off me,
for
man.
real,
She
bro.
breathing hard on you.
Oh, that's gonna resonate with so many people. That's funny.
It has to resonate with a lot of these nurses.
Oh,
But
man.
that's the OSCEs, man. Very intimidating, but as you progress, you get easier, and it gets easier, and you'll be fine, honestly. Oh my God. Yeah, good times, right?
Yeah, bro. Oh man. Yo, that actually reminds me, just real quick, last thing. Like I remember, maybe I do remember having like people there, because I remember once I was the person there for someone else.
Right.
And it wasn't an OSCE though. Anyways, I remember it was for injections. It was like whatever. And I was the person, that was the patient, and there was someone injecting me.
Oh, like a sub-Q or IM?
Yeah. So it was a sub-Q, I remember, sub-Q needle. And this girl that was doing the injection was so nervous, bro. And I could see her like having a tremor.
Yeah, just shaking.
And I was like, oh, damn, this is the wrong fucking person. It's before she even picked up the needle, I was like, she might get me, bro.
Oh, man.
Because obviously you're supposed to fake it and all these things, but they're real needles, right? Because and the reason that is because they have to see you put the safety on and everything.
Right. The safeguard, yep.
So, bro, and on my leg or something, it was IM. So now I remember. It was IM because she's supposed to give me an injection on the leg. And on my leg, they like taped this fake thing that even if she jabbed this needle through, it would never come to me.
Okay.
So they have to see her like, do the Z whatever.
Z tracking
and all that stuff. And
alcohol swab in a circular
bro, but
motion.
she's like having a tremor. And I was like, and I looked at the instructor like, yo, don't let her get me right now, bro. And dog, she was like sweating. You could see the moisture on her hands.
Cold and clammy.
And bro, she went, and it was like I knew she was gonna fuck up. So maybe I also like made her fuck up at the same time. But she was like falling over because she was like so unsteady. But I moved at the same time.
You evaded that shit quick
today. Yeah, no
and needle stick
she
injuries
looked
today.
at me weird, but then the instructor looked at her like, "What are you doing?"
Yeah,
and I was like, "Damn, you failed. I'm out. I gotta go. I can't do this again."
What was it, second year,
bro? That was like first year because you're doing injections, right?
God damn,
bro. I never saw that girl again. I think she flunked out after that, but I was like, because the instructor was like, "Yo, you need to stay back. I need to talk to you about this."
That's wild,
bro. I never saw her again. And I recently saw her like Facebook. She looks like she's an OnlyFans model. I hope you're doing better. I'm sorry if you failed because of me, but I wasn't gonna let you get me. Right?
And that wraps up the episode.
It was crazy.
Oh man, that's crazy.
Oh my god.
Peace,
y'all. Oh man.